When someone suffers cardiac arrest or when someone's breathing stops, it's important to begin CPR to keep the oxygen-rich blood flowing to the brain and other organs until a typical heart rhythm can be restored.
News Channel 2's Kirk Tupai tells us about the importance of knowing CPR and other life-saving strategies.
Cardiopulmonary resuscitation, better known as CPR, is a life-saving technique that uses compressions to the chest to keep blood flowing to vital organs. It's also important to keep a person's airway opened and use mouth-to-mouth breathing to deliver oxygen to the lungs. MVHS emergency room clinician Greg Myers talked about the importance of performing CPR.
Almost everybody can do CPR, and hands-only CPR is better than no CPR at all. It provides a patient a better chance of survival. It allows us to provide circulation to the brain, which is key.
In a medical emergency situation, there are a few steps that should be followed. First, call 911 or ask someone else to. Lay the person on their back and open their airway. Check for breathing. If they're not breathing, start CPR. Perform 30 chest compressions, followed by 2 rescue breaths. Repeat the process until an ambulance or automated external defibrillator can be used.
Early CPR is key to survival, as well as early application of an automated external defibrillator. So having those available in public buildings or schools, libraries, things of that sort, is proven effective to save lives.
So effective, New York passed Lewis's Law that requires AEDs in all public schools and athletic events. The device helps save lives and is easy to use.
An 8-year-old can follow the instructions, so the most important thing you have to do is just turn it on and do what it tells you to do, which is why there's such a great resource in places like libraries and public pools, things like that.
There may be signs leading up to a cardiac event, such as shortness of breath or chest pain.
Sometimes, but not always. Sometimes they're atypical presentations, especially in somebody that has other medical conditions. They may not experience the same symptoms routinely. It's not always chest pain and shortness of breath. There's a lot of symptoms that would cause us to evaluate things.
There's a number of in-person and online CPR training classes offered in our local area. We'll provide a link to some of the classes offered on our website, WKTV.com. In Utica, I'm Kirk Tupai reporting for News Channel 2.